guys, this is Dr. Jonas Apostol. Guys, I'm back again after a long hiatus. It's been more than a month. So I'll be discussing to you this case. This is a very interesting case. So here is a 32-year-old male patient. He went to the clinic with a chief complaint of having this not so aesthetically beautiful smile, no? So he wants that to be enhanced. He's actually was based abroad and then he came to the Philippines to process the papers going back to another country, but na lockdown siya dito. After like few months, nag-decide siya to have his smile enhanced. So we only have like few weeks to go. He will be flying soon. So as I did the assessment, of course, we did the clinical and radiographic assessment like x-rays, impressions, pictures and all, so that we can be able to assess it properly. So when we did the x-ray, we found out that there's infection. Okay, it's very crucial to a case if there's any infection, but we have to make sure that it's healthy. So we did the treatment plan now. Ang gagawin muna is root canal treatment, and then saka na yung smile makeover. Root canal treatment is very important to make sure that all the bacteria inside the canal will be removed. With the root canal treatment, we cannot ensure the timeline because we want to be certain of the canal if it's dryable or not. Usually after the first session, we have to wait for another 2 weeks to make sure that the medicament inside the canal is working. So if it's dryable enough, then that's the time that our endodontist would seal it, and then after the sealing or after the root canal treatment, that's the time that we can start with our restoration part. So for this specific case, we waited for 2 weeks now to finish the root canal. So this is the case. As you can see, it's a lingual locked lateral incisor, and also it's edge to edge. But may basag-basag na yung mga central incisors niya. It's because of the occlusion na mali. There's a heavy bite in this area, and it will actually damage further the teeth, and also not just that, the supporting structure. So we will fix the bite. We will also fix the alignment. And also, as you can see here, when the patient smiles, medyo hindi masyado nakikita yung ngipin. So we will also enhance the lips. If there's no problem, or if the patient is based here in the Philippines, it's a simple orthodontic treatment to correct the bite. Okay, madali lang to with braces, but since there is no time, no, wala nang time, the patient will be flying soon, then ang gusto niyo mangyari, aayusin namin to through cosmetic dentistry. Why? Because he will be back like after 3 years. Pag babalik siya dito, he is not really certain of the time na we stay siya dito or not. So gusto niya na maayos because it's also affecting his confidence, no? So he doesn't wanna go show the world his smile, yet he's not confident. So gusto niya maayos. So our second best option is through dental cosmetic. We have to make sure that the 2 root canal treated will be crowned because there's a huge damage. Actually, it's not that visible in the picture, but sa likod medyo super damaged na siya. So we want to make sure that we encapsulate everything. We restore it from back to all the structure of the teeth now. And also it should be a 10-unit restoration or combination of veneers and crowns to be able to achieve the beautiful smile. Yung budget ng patient is actually for 6 units. We can actually do something wonderful with the 6 units. So yun.
A few moments later.
I did a direct mock-up. I actually used composite, designed the veneers directly in the patient's mouth to ensure the aesthetics is really in harmony with the face. And also the color we manipulated with the temporaries. para at least we will not guess the color that is suitable to the patient's skin tone and the face. So after finishing the design, we took impression and also we did the preparation. After that, we took a final impression and then sent it to our laboratory. I have an own dental laboratory in my clinic to be able to ensure the quality of the ceramics that we're producing. That's one of the secrets of the Apostolified Smile. So here's the final ceramics. As you can see, they followed my design, yet they incorporated all the nuances of the natural structure of the teeth, like the translucency here, the perichemata, and also some serrations. And I like it if it's glazed properly so that the patient will feel that it's smooth. When we cement it permanently, we make sure that we do some try-ins. So as you can see here, the other tooth is a little bit longer than the other. So we made some adjustment, few modifications just to make sure.
A few moments later.
So this is the final outcome of the smile makeover that we did for a patient.
Wow!
So as you can see, it's very natural looking. It's a dentofacial aesthetic approach and also biomimetic. We also made sure that it looks really natural and also the color that would blend perfectly with the skin tone of the patient. You can see there's a 6-unit combination of crowns and veneers. You can see all the mamelons, you can see all the translucency, and also we extended a little bit of bulk dito. Naglagay ako ng bulk just to ensure that it would look really natural and healthier version of his teeth. No cavities, it's straighter, it's a little bit whiter, it's actually shape E2. This case is a class 3 with a lingual lock lateral incisor. We've been able to address all these things. Like it's straighter, hindi na siya naka-lingual lock, hindi na siya edge to edge. So in Apostolified Smile, it's not just about the teeth, but also the dentofacial aesthetics. We make sure that it is not just about the teeth, it's also about the face. It should be in harmony in the patient's face. And also, the lips, we enhance it also. Here, there's a lip support. Whenever he smiles, nakikita nyo dito, hindi na siya lubog. And it looks pretty, it looks even, it looks natural. Because the teeth is very important in the contour of the lips. If it's flat, then the lips will become flatter as well. It will take like few weeks to adjust kasi syempre it has memory yung muscle natin. So, a few weeks, like 3 weeks to a month. The material is zirconia fused to porcelain. I chose the material, it's because of its durability. At the same time, it's aesthetically top-notch. Actually, the patient requested for a cheaper material, which is a composite kasi it's pandemic and all. But I actually discouraged the patient not to go with the composite, especially with this case because it's crown. There's a huge adjustment, there's a huge problem. So we need to make sure that the restoration is durable. So since also na-base siya abroad, so kung mabasag yung composite, the amount of money na babayaran niya doon, it's way too expensive. So, mas maganda na nagawa namin ng paraan na pinaka-the best na material. I do a lot of composite veneers, but I always make sure that it should be an advantage on your part because I don't want you to invest in a smile na hindi naman tatagal. That's why I make sure that all the materials that all the treatment that you get from my dental office will be the best treatment, and also it will last longer. So it's really, really good, and I'm so happy for the patient, and the patient is very, very happy as well. So it's my goal to give everybody an apostolified smile. If you do have any questions, just approach us in our IG at Apostol Dental, sa FB, Makati Dentist with Apostol Dental. And just want to remind all of you that what we're doing here is a pure spread of positivity in this very toxic world. I know that everybody is suffering from a lot of things. It's because of what's going on. But let's just pray and hope that God will guide us every single day sa lahat ng mga endeavors natin na ginagawa for our family, for ourselves, for the people that we love. Let's just be more strong and hold on to the thought of everything will be alright if we just believe that God is in control. So, God bless, and I'm gonna see you again. I'll be uploading a lot of videos for you to be able to relate, specific cases. So, I'm so happy that I'm back again, and I'm so happy that I can be able to serve all of you with this video, and also for those who are parang interested in coming to our office, just don't hesitate to book an appointment with us. Thank you very much.